Cardiac arrest is sudden stoppage of the pumping activity of the heart. The vital organs cease receiving oxygenated blood and stop functioning soon. The person loses consciousness soon and falls down due to loss of postural muscle tone. A superficially similar situation is a fainting attack, which is transient and recovers spontaneously. Cardiac arrest can be recognized by absence of pulses and gasping or absent breathing. Unless immediate steps are taken to restore the functioning of the heart, the brain becomes dead and the person cannot survive. Measures to start the heart pumping has to take place within the vital 4 minutes for best results. Cardiac arrest could be due to two types of electrical mechanisms. One is complete cessation of all electrical activity of the heart, known as asystole. The other type is a fine irregular electrical activity known as ventricular fibrillation. Ventricular fibrillation is the more common mechanism and is a fine, irregular, very fast electrical activity which does not permit organized contraction of the ventricles, lower muscular chambers. Conventional cardiopulmonary resuscitation involves supporting the heartbeats and the breathing. First, the airway has to be cleared of any obstruction and the chin has to be lifted up to prevent the tongue from blocking the throat. After this, mouth-to-mouth breathing can be given by taking a deep breath and blowing into the mouth of the victim, keeping the nostrils closed. Regular chest compressions are given to squeeze out the blood from the heart into the circulation. 15 compressions for every 2 breaths is the. As cardiopulmonary resuscitation involves giving mouth-to-mouth breathing, many are hesitant to do it for a stranger. It is mostly due to fear of acquiring infections from an unknown person. This fear is unlikely to go off in this era with increasing prevalence of potentially dangerous infectious diseases. Sometimes the social embarrassment is also an issue in providing mouth-to-mouth breathing in a public place. Cardiac-only resuscitation or compression-only resuscitation is probably the only solution to improve the rates of resuscitation in public places. In compression-only resuscitation, only chest compressions are given and no mouth-to-mouth breathing is given. Studies have shown that compression-only resuscitation is not very inferior to full cardiopulmonary resuscitation in most situations. Soon after a cardiac arrest, blood has enough oxygen for the cells to utilize. Just compression itself can move some air in and out of lungs even without giving mouth-to-mouth respiration.